Hello friends, today we'll talk about arteriovenous fistulas. What are the benefits, time that they take to mature and why do they fail? I am Dr. Rahul Agarwal, consultant vascular endovascular surgeon from Care Hospitals. Now, what is a usual time that a fistula takes to mature? It is about 6 weeks. Now this 6 weeks is given to the fistula for it to mature. During this maturation, the high flow from the artery flows into the vein, which leads to dilatation and thickening of the vein wall. This thickening and dilatation allows us to puncture the vein, to take the blood from the vein and then give it back through a different puncture into the same vein. Now, this 6 weeks of duration is required for its good maturation. If we do an early puncture, then the vein may not be thick enough to sustain the repeated puncture and it may give away, leading to bleeding and loss of fistula. Now, what are the benefits of fistula over other options like a perm cath, HD sheath or an AV graft? The benefits are it is cheaper, it is patient's own artery and vein, so there is no foreign body inside. The chances of infections are less, the chances of complications are less, and the chances of failures are less. So longer life, cheaper and lesser complications. Now, why do fistula fail? Most common cause of a fistula failure is stenosis. Stenosis is narrowing of the vein. The most common site for narrowing of these veins are between the puncture sites, the site where the fistula is done, or somewhere around the shoulders of the patient where the vein goes and join into the bigger veins of the body. Now, other reason for the failure is maturation failure. Initially itself, if the vein of the patient is not good in caliber, then it may not mature or it may not reach the adequate required size to initiate hemodialysis. That is known as the maturation failure. So the another reason for failure is stenosis or occlusion in the central veins of the patient. Now, this stenosis or occlusion could be because of the repeated catheterization of HD sheaths or perm caths into the patient's bigger vessels, which are into the neck or in the thighs. To avoid fistula failure, you should avoid HD sheath usage, get an early fistula and wait till it good maturation before initiating hemodialysis. Thank you.